A new CBS News poll finds a good number of parents are still hesitant to get their kids vaccinated against COVID-19. 37% of parents say that they will vaccinate their young children when the shot becomes available for their age group. 26% are unsure, while 35% will not inoculate their kids. And this comes as Halloween approaches. For more on this, let's bring in Dr. Thomas Talbot. He is the Chief Hospital Epidemiologist at Vanderbilt University Medical Center. Thank you so much for joining us. I'm sort of surprised at those numbers, but not entirely. I know when we first started talking about a vaccine and how rapidly it was being developed, I became comfortable with the idea of getting the vaccine, but I was still uncomfortable with my child. Now, fast forward, obviously many, many months, and I've been inoculated for a while now. I can't wait till they approve the vaccine for my daughter who's 10. I think I would be breathing a sigh of relief, but I understand the concern from other parents. Parents are still conflicted about vaccinating their children. So as an epidemiologist, what are your concerns over portions of the population perhaps still refusing to get inoculated?
Yeah, great question. Thanks for having me. I think those numbers aren't surprising, as you noted, because if you go back to last November and if you ask any adult, the numbers are about the same. And so I think as we get more data of the vaccine in kids, that'll change. I think one unfortunate story of the pandemic is, as we were learning as we were going, some stories or themes became mantra. And I think one of the mantras was kids don't get sick from COVID. And I think if anything, what we're seeing now with the Delta variant, with thankfully kids being kids and doing camps and going back together in school, that unfortunately kids are getting sick with COVID. And in fact, rates of disease right now are as high as they were for 40, 50, 60-year-olds last winter. And so I think it's really important, as my concern is that parents may think their kids are not at risk, either for infection or even the complications of you hear things like long COVID or inflammatory syndromes we're seeing in our kids. So that's one concern, is that we've kind of undersold the risk to our children. Two, we want to get everybody vaccinated to prevent the onset of another variant like the Delta variant. And because I don't know about you, I don't want to have another wave like we just had. I'd like to just get back to normal.
Mm-hmm. Doctor, let me ask you about something else. Merck and Ridgeback Ridgeback Biotherapeutics have filed an emergency use authorization with the FDA for its COVID-19 pill to treat infected adults. Explain the impact an at-home drug could have on hospitals and containment efforts. When I saw the news, I sort of celebrated, because this is just one more arrow in the quiver, the arsenal, to combat deaths from COVID-19.
Absolutely correct. And I think one of the amazing stories of the pandemic is the advancement in science and how we've really, in just a year and a half, had such therapeutics. And so now to have an oral pill, kind of similar to people are familiar to Tamiflu for influenza, but to have a pill we could give folks that are not sick enough to be in the hospital and even prevent them from having to go in the hospital is really a huge piece of our arsenal. We want to make sure people don't think that that's a replacement for vaccination. It's one of those tools along with vaccination, but it's very, very exciting to have that option for us as a clinician, as a place where we've seen our hospitals faced with surges of infected patients. If we can prevent them from coming in the hospital, being sick, from being harmed, that's fantastic.
But doctor, just to your last point about people who, that it's not a replacement for people who are not vaccinated, but what if, you know the reality of the situation that we're dealing with here in this country, and not just here, in a lot of other countries too, that some people just say, look, I don't want this vaccine. If this pill is available and it prevents them from having to go to the hospital, prevents them from getting seriously ill, I mean, what's wrong with people saying to themselves, look, I'm going to take the risk of being out and about and living my life without being vaccinated because I know that now medical science has come up with a way to keep me off a ventilator?
Yeah, great point. I think what people forget in the whole conversation is the risk of spreading to other people before you know you are sick, and other people that can't protect themselves from vaccination. And so you could, once you realize you're sick, take the pill. But by that point, you may have exposed other folks, maybe your grandmother who has cancer, your 8-year-old niece who can't be protected from vaccination. And I think that theme and the reason we vaccinate has really been lost in the equation of it's my personal choice to vaccinate or not. But we can harm others, just like we can't go out and smoke because the risk of secondary smoke to others indoors. we need to think about how our breath can hurt other people. And so that's my answer to that, is the pill doesn't replace that. You won't know when you're infected, and you can still spread to other people.
That's a great point, Doctor. Millions of Americans are now eligible for booster shots, but the federal government hasn't said if mixing the booster with the vaccine that you initially took is something that is being suggested. Okay, meaning the only booster shot that's been approved thus far is Pfizer. So if you had Moderna, are you eligible? Should you take it? Do you even need to? Because I don't know what the efficacy is for the Moderna vaccine versus the Pfizer vaccine. Or, Johnson & Johnson. We have some numbers, some data on Johnson & Johnson and the reduction in efficacy, but I don't know if Moderna has actually released that kind of information. So what do you do if you're eligible, but you got the Moderna shot? Should you go for a Pfizer booster?
I would say hang on for about a week. The end of this week, the FDA's advisory committee is meeting about the questions of both Moderna and J&J boosters. Moderna is a higher dose of vaccine that we gave spaced out a little bit more. And so the data with Moderna show that maybe we're not losing effectiveness as quickly as Pfizer. So that's one interesting theme. But I think we'll get more answers to that from the FDA, and then after that next week, the CDC. The question of mixing and matching is really interesting, and the United Kingdom has been investigating this with the various mixing and matching. And so we're hoping that those results will shed light too on individuals as to whether you can switch. Is there a benefit to switch? Is there a harm to switch? So I would say hold tight, but you don't need to hold on very long, because I think we'll get some information by the end of the week.
Yeah. Doctor, so let me ask about your personal experience there. Your hospital mandated the COVID-19 vaccine. Were there any impacts from the decision? What are the overall attitudes like within your own staff?
Yeah, so we're one of many hospitals that, for the protection of our patients that can't get protection from vaccination and our coworkers, we've required vaccination. And it's been a process. It's been going on for about 2 months now. Our compliance deadline was last week, so we're sorting through. Unfortunately, we're not going to lose many of our colleagues. And in general, it's really been well received as another measure to protect each other and protect our patients who we are entrusted to care for. So we've really been very supported, and a few folks haven't liked it, but most understand why we're doing that and the rationale behind it. So it's been I'm glad our institution went forward with this. It's part of our culture and part of our commitment to safe care.
Yeah,
Good
really
stuff.
important.
Well, Doctor, Doctor, thank you so much for spending some time with us.
Hey, thank you guys for having me, and hopefully get out of this wave and get back to a normal fall and holiday season.
Yeah, looking forward to that, Dr. Talbot.
Indeed.
We appreciate it, sir. Thank you.